should you trust a doctor who Googles while treating you? In my practice, and I've practiced now for 10 years, I've seen patients who told me that if a doctor Googles in their presence while attending to them in the clinic, then they completely lose trust in that doctor, because in their opinion, it makes the doctor look unqualified, unsure, and not smart enough to handle them. And in a way, I get it anyway, because if you Google in presence of your patient while attending to them, it makes them feel like you're not 100% sure of what to do. And that can be damaging. It can damage your reputation as a doctor. But now, here is the issue. Do you want your doctor to treat you well? Or do you want your doctor to show you that he knows everything? Now, for sure, doctors have trained a lot and they have studied big volumes of books. But they are not encyclopedias. And they know a lot of things, but number one, they don't know everything. So meaning they may know 90%, but there is 10% out there that they still don't yet know. Why? Because knowledge is a continuous process. And even today, there is new knowledge that is coming out that the doctor does not yet know. Number two, there is this pesky thing we call the Dunning-Kruger effect. Now, what does that mean? That means that with higher training, then your level of confidence wanes. So people who have low-level training will be very confident, but people who have high-level training will have a bit of self-doubt. And that is because they start understanding that knowing what you don't know is even more important than knowing what you know. So they don't want to do things that may harm you as a patient. So in a way, they're trying to protect you. So after having said all that, what are the reasons that a doctor could Google before attending to you? So these are the legitimate reasons that a doctor could Google before attending to you. Number one, I say that new knowledge develops every day. So you could be checking the latest literature from the best medical journals to see what is latest out there concerning how to treat you. Number two is they could be checking the correct dosage for a particular drug that they have chosen for you. Number three, they could even be checking whether the drug that they have chosen for you is the best, or that they could switch to a better alternative, and that will be based on the history that you have provided to them. As we know, humans are not factory made, and each person is different. And based on the doctor's assessment of how different you are from other patients, they could be checking which drugs will work best for you. Another reason is they could be looking at images online to show you and educate you. I've done this a lot. So you want to explain to a patient what this condition is. So you are looking for images online on Google to show them and explain to them what the condition is. And this will aid in patient education. Number five is that they could be checking what we call contraindications. And that means that a situation within you that is different from that is within other patients that could cause a certain drug to be deadly for you, while it is not deadly for other patients. Number six is maybe you're pregnant, and they could be checking how the drug that they have chosen for you or the procedure that they have chosen for you affects the pregnancy, so that they adjust how they handle that particular situation. As I said, every situation is special. Number seven, maybe you are presenting with a very rare symptom or a novel symptom. You have heard of rare genetic conditions. So maybe that is the first they have seen in their life, and they are confirming to check whether it is true that what you are presenting with is a very rare symptom that could point them towards a very rare disease. And finally, what they could be checking is something that we often check a lot, and that is online calculators. So in medicine, we have these values that we input into online calculators to give us a result that can help us numerically assess the severity of your illness, or other numerical figures while managing you, like the body mass index, the due date for your pregnancy, the ovulation date if you are trying to get pregnant, or the glomerular filtration rate if you are a kidney patient. So what I would say concerning all these is that doctors actually do know what they are checking. Just like in any other system that takes in input and produces output, Googling operates on the principle of garbage in, garbage out, or quality in, quality out. So when a doctor Googles, it's not the same as when a patient Googles, because a doctor is informed and they know what they are Googling about. And they also know how to interpret the results of what they are Googling about. Now, when a patient Googles, they need to know one thing, that Google algorithm operates by reinforcing your worst fears. This is called confirmation bias. What other thing happens when you Google? You tend to catastrophize. So you tend to look at the worst case scenario. So if you have Googled a certain condition or a certain symptom that you have, you tend to gravitate towards and making it seem like it's the worst of that symptom. For example, if you Google chest pain, Google will list a range of diagnosis for you, ranging from a safe diagnosis like gastritis to deadly diagnosis like a heart attack. And you having that mind of a human being that catastrophizes everything will tend to gravitate towards thinking it's a heart attack than thinking that it's gastritis. What other thing happens? So sometimes you prescribe to a patient medication and they Google the side effects of those medication. So the same issue of catastrophizing of side effects occurs in the sense that most medications will list even death as a potential side effect. And the human mind will gravitate towards that and ignore the safer side effects like nausea and vomiting or gastric irritation. So the patient will keep telling you, will I die from having this medication? And sometimes I tend to tell my patients, don't Google anything concerning your treatment and let the doctor handle everything. I've really explained a lot about why doctors can Google concerning health conditions, and it's a bit different when patients Google. Now you know enough not to accuse your doctor of being a quack when he Googles. Thank you.